We've been raised to believe that medical tests are always a good thing. The annual checkup, the screenings, and the scans sound safe, right? But here's the shocking truth. After a certain age, some of these so-called routine tests can do more harm than good. And yes, some can even be deadly. After 60, your body changes the rules. So, tests that may save lives at 50 can destroy them at 75. There's one test doctors still aggressively recommend after 70, even though it's linked to far more senior deaths than most people realize. I'll reveal which one that is a little later, so stick with me because it might just change the way you think about medicine forever. You'll likely rethink the safety of standard medical tests after this. Today we're pulling back the curtain on the dark side of screenings after 60. This video could literally save a life. Think about it for a moment. A test is ordered. It feels responsible. The test seems like a proactive option. You go through the procedure and wait for your results. It's assumed that the information gathered will guide you toward better health. But what if the test itself introduces new dangers? Medical testing has been framed by doctors as the ultimate seatbelt, always protective, simply necessary. But after 60 or 70, the seatbelt may sometimes be the airbag that explodes in your face. When you're young, protections are unequivocally life-saving. Yet your body becomes fragile as you age, so what used to be minor becomes dangerous. The device didn't change, while the person did. With sedation and anesthesia, complications skyrocket with age. False positives lead to invasive follow-ups that can spiral, and frail, older bodies don't bounce back. After 60, the numbers flip. Tests that once offered protection now carry greater risks, with harm often outweighing the benefits. Consider George, who is 78. George is an active senior. He regularly gardens, takes walks with his dogs, and has no symptoms. When a routine colonoscopy was suggested, a small tear formed, then infection set in. The emergency surgery that followed forever changed his life. George spent a week in the ICU. He lived, but the experience left his health profoundly altered. He left the hospital with a permanent colostomy and chronic pain. Not saved by a test, but harmed by it. Could your next routine test start a cascade that you can't control? After 75, benefits drop and harms rise. Even preparation before a routine medical exam can be grueling. Side effects can include dehydration, electrolyte imbalances, kidney strain, to name a few. In heart disease, fluid shifts can provoke arrhythmias or failure. Arrhythmias are abnormal heart rhythms caused by disruptions in the electrical impulses that control the heart's contractions. Older colons are thinner, thereby perforation risk rises, so complications increase the older you get. A tear often means emergency surgery and time spent in the intensive care unit. These are life-altering outcomes. Typically, polyps present a low risk to your overall health. Polyps are small, non-cancerous growths that can develop on the lining of various body organs. For older adults, the risks of a colonoscopy include bleeding or complications from anesthesia. These can sometimes be greater than the danger of the polyps themselves. Mammograms aren't benign in older ages either. False positives surge. The non-invasive form of breast cancer, called DCIS, may never harm you. Yet it can trigger biopsies, surgery, radiation, and hormone therapy. Treatments carry pain, bleeding, and exhaustion. Evidence is insufficient beyond 75, and that uncertainty should give pause. If a cancer won't shorten your life, is treatment worth the toll? Early detection isn't the same as better living. Remember the dangerous test I mentioned that many doctors insist on after 70? We're getting closer. A prostate-specific antigen, PSA screening, seems harmless. After all, it is just a blood test. But elevated numbers lead to biopsies, infections, and cascades. In medicine, a cascade happens when one treatment causes a problem, leading to another treatment, which can cause more problems and more medications, sometimes harming the patient. Overtreatment brings incontinence and impotence. Guidelines discourage PSA screening after 70, yet habits persist. Stress tests can provoke arrhythmias and even heart attacks. False positives push catheterizations and stents. A stent is a small mesh tube typically used to hold open passages in the body, such as weak or narrowed blood vessels. Many imaging tests like CT scans or angiograms use contrast dye. In older adults, kidneys are often weaker, so the dye can push them into kidney damage or failure. During these tests, risks of bleeding and stroke increases. An older adult, living well, may be pulled into treatment simply because a test gave the wrong signal. The domino effect of medicine persists. One test triggers a chain of more tests, and with each step, the harm potential increases. Are we preventing a problem or manufacturing one? Not every yes is protective. Not every no is neglect. Put in the comments below if there's a test you have a question about. A CT scan uses X-rays and computers to create detailed cross-sectional images. A PET scan uses a tiny amount of radioactive material to show how your organs and tissues are working. CT and PET scans deliver radiation, and repetition raises lifetime cancer risks. As discussed earlier, contrast dyes from these tests can injure aging kidneys. MRIs may trigger anxiety and dangerous blood pressure spikes. DEXA is safe, but false positives lead to risky drugs. DEXA is a quick scan that measures bone density. The test most pushed after 70 and tied to deadly complications is the colonoscopy. After 70, the risks of complications during a colonoscopy rise sharply because perforations, anesthesia complications, and even problems from the bowel prep become much more common. A colonoscopy can save lives in the right decade and end them in the wrong one. Fatal perforations happen, especially in frail seniors. The question worth asking: will this colonoscopy improve my life or create risks that I can't recover from? After 60, the smartest test is often a question. What will this result change today? A borderline sugar reading can turn into a diabetes label, and medications can drop your levels too low. Hypoglycemia leads to confusion, fainting, falls. One fall can mean a hip fracture. For many, this is the beginning of lost independence. High-dose statins may cause weakness, and more falls, resulting in more frailty. High-dose statins are strong cholesterol-lowering drugs used to prevent heart attacks and strokes. Vision and hearing checks matter, but beware of reflexive procedures. In medicine, reflexive procedures are tests or interventions that doctors order automatically or routinely, often in response to a single result, without fully considering whether they're truly necessary for the patient. Anesthesia and infection risks can overshadow gains in late-stage dementia. Ask if devices or surgeries improve life, not just test scores. If a borderline number risks meds and falls, what's the safer path to the same goal? Sometimes the answer is movement, meals, and monitoring, and sometimes it's deprescribing. Practical steps beat risky cascades. Quality first, then quantity. Do less, but be smarter. You're in charge. Hospitals profit from tests, fee-for-service rewards more. Colonoscopy, mammogram, stress test are all billable. Regarding defensive medicine, it's safer, legally, to overorder rather than to pause and reconsider the best options. Fear of missing something drives cascades. We're supposed to be sold in believing that more testing equals better care. But guidelines lag. Research takes years to reach clinics. A one-size-fits-all approach usually fails the elderly. In frail seniors, colonoscopy perforations aren't just complications, they can be deadly. Stress tests can trigger cardiac arrest, biopsy sepsis after PSA cascades. Kidney failure can take place due to contrast dye. These aren't hypotheticals. These are real cases buried in medical journals. Who guards your guardrails if not you? Make the system serve you, not the other way around. The good news is, you're not powerless. Ask medical professionals, will this test change my treatment? If the test results are positive, what's next and what are those risks? Also ask your doctors, what is the false positive rate, and then what? If we find something, what are treatment harms? What if we watch and wait? Know the cutoffs. Many stop colonoscopies around 75-85 and avoid PSA after 70. After 75, mammogram results can become unclear or misleading. Align your wellness with life goals. Better living over better numbers. Get second opinions, especially before invasive steps. Good clinicians embrace informed choices. Bottom line, screenings aren't treatments. Early detection isn't a guaranteed benefit. Routine isn't always safe after 60-70. Ask the hard questions yourself because it could mean life or death. If you're over 60 or caring for someone who is, hit pause before the next test. Ask how results will improve your life, not just fill a chart. Share this to protect someone you love. Subscribe, like, and stay informed because smarter choices save lives.